So here's the basic principles. You don't have to see me. You don't have to see anybody. Change your diet, nutrient values. See those pictures there? Wholesome foods. I like to start my patients off with a low glycemic Mediterranean diet. It's been around for thousands of years, lots of science on it. It's a good starting out. Because people say, well, I like the paleo, I like the Atkins diet. Okay, well, that's good. Some people do real well, some people don't. If you want to go that way, well, let's try it. Let's see how you do. We can do some testing, make sure that you're healthy like that. Other people, there's like the Dr. Dean Ornish, Dr. McDougall, they're into high complex carbohydrates, vegetarian type of diets. People do fabulous on that. Other people say, oh yeah, when I'm on high carbs, this, that. Okay, well then that's, so we have to find what your unique individual type of program is, and that's what I help people. I'm a coach.
Doesn't it always doesn't what your blood type too have to play a
Dr. D'Amato, which is a naturopath, has a number of years came out like that, and it's a guide. Blood type is, there's 4 basic blood types, so I mean it's a very general type of thing, but it can give you some guidance. But we're very, very unique. Take the 7 billion people and put them into 4 groups. I'm talking about there's 7 billion individuals out there, and you still have to, even if you want to use that, which I'm happy to go over, well versed in it, we start you on like that, but then we have to fine tune it. We don't have to be regimented thinking that, this is an, absolute, in granite like that. So even though the foods that says you can't have, you do it, we don't seem to have any reaction, we do some testing, then that's fine. But, so there's lots of different approaches. Like, the saying is, there's lots of roads to Rome. There's lots of different ways to go. You don't have to be a vegetarian. You don't have to eat just raw meat. I mean, there's lots of things in between. So in this first slide here, wherever you are, you need to eat, irregardless of your paleo diet, Atkins, McDougall, vegetarian like that, wholesome foods. No one advocates on any of these type of, programs like that. You eat junk food, stuff in cans and boxes, try to limit that as much as you can. So fresh fruits and vegetables the best you can. Then we have to deal with inflammation. Inflammation is the big deal right now for the last at least 15 years. As this Time magazine article said, the silent killer. Now we all know that when you have inflammation, that is a systemic type of problem. That's all over your body. And it causes little things like cancer, Alzheimer's, dementia, osteoporosis, osteoarthritis. All these factors have a big, big concern. So inflammation has to be reduced. And so by diet and programs, you're able to reduce the inflammation without killing you. Of course, there's anti-inflammatories. We talked a lot about those. Unfortunately, they kill a lot of people. We talked about, excuse me, opening part of this TV show was about Vioxx, which was a number of years ago. Non-steroidal anti-inflammatory, COX-2 inhibitor, was great. It was a rave, made billions of dollars, but it's killing people. It killed more people than the Vietnam War. So 23 people die of cantaloupes, and they're throwing the farmer in jail. They're closing down. People don't want to eat cantaloupes, but when tens of thousands of people are killed by a drug, it's like, oh, okay, next drug, and that kills 10,000. Oh, who cares? 1 person every 3 minutes is killed by medical drugs and procedures. Who said that? Health and Human Services, a government agency, not the herbalist and your local, health food store people. These are people that just read the statistics. So it's actually higher than that. So inflammation is a big deal. Oxidative stress, big deal. We've talked a lot about it. We had guests. I'm a real big proponent on a new revolutionary oxidative stress reduction called Protandim. It's able to reduce oxidative stress to a baby in 30 days. Major breakthroughs. They just came out with a new study about what's called NRF2 activators. This is a real cutting edge. It's not so much in terms of working on metabolic pathways, it's actually cell communication. And these NRF2s are able to communicate down to your genes and able to up and down regulate, just like I told you earlier. So this is really cutting edge. Oxidative stress is the root of over 225 diseases. You got a problem, oxidative stress is related to it. Here's something that you have to deal with. And so now we have means that, and there's nothing else out there that can do this that's been supported by good science. The good bugs in your intestinal tract. There's actually more probiotics in your intestinal tract than all the number of cells in your whole body. So it's a big number of life force in your body, and you want to have good guys, not bad guys in there. So good type of probiotics, that's where your yogurts. Unfortunately, most of the yogurts you got there is very sweetened. It's like candy, it's like dessert. The amount in there is usually not enough to get through. I use a system from Australia. It's not in billions of the B, it's actually in trillions. And so trillions are a big deal. And here's the example, not only in terms of our debt, but in big deal. 1,000,000 seconds is about 12 to 13 years. A billion seconds is about 31, 32 years. A trillion seconds is 32,000 years. So when you go from a billion to a trillion, we're talking big jumps. And so you want to have good bugs in there, and you should be taking. If you're on antibiotics, even back in the 40s and 50s, even the drug doctors knew that after on antibiotics, that kills both the good and bad bacteria. They would give you some re-inoculate you with some probiotics. I hear it sometimes a little bit, but that's something important so that you can re-inoculate your intestinal tract, because that's where most of your immune system is. That's where most of your neurotransmitters are. Your gut is a big deal. Even though you think your brain's up here, what happens down in your gut has an influence. The gut-brain connection is a big deal, and so it's a must in terms of being healthy. Detoxify on the chemistry of your body like that. So detoxification is an important factor in all different type of systems. I use a system that just, it's a little more scientific. It has a medical food and a certain type of dietary restriction, works great, has good science. I've actually been able to test what's called phase 1, phase 2 detoxification. So it's a great thing. Number 6, hormone neurotransmitter balance. Got to have that in terms of good health. So you're getting a feeling about something that you can do, some things you need to step out and find a real health professional. Just like your car. There's some things you work in your car, other times you have to go see a car mechanic. Intake of toxic chemicals. This is something you can do. Start paying attention. What's around you? Read, watch my show. The cosmetics on your face, once again, carcinogenic. The sprays of cleaning and pesticides and herbicides, toxic stuff, natural alternatives out there. Immune system, key factor in terms of anything that you're worried about in terms of helping your body be able to function right, especially when you're dealing with like the big C, cancer. So in natural medicine, we modulate, we make the immune system healthy. The drug system either tries to suppress and shut it off or, most of the time, and they have very little to actually increase it. What they do is they use other types of alternatives, like antibiotics. Antibiotics have nothing to do with your immune system. What it does, it interferes with an enzyme in bacteria it's not able to replicate as well, so it dies off easier. Great technology, great success. Unfortunately, over the last 50, 60 years, it's been misused, and now we have resistant strains. We talked about MRSA, superbugs out there. Well, the natural things I use actually still work on those things because it actually has the basic foundation of a good immune system there. And your sleep, an important factor in terms of your health and well-being. If you have sleeping problems, you can't be healthy. So I work on that and have great success. And food intolerances, that goes a little bit with the detoxification. Some foods are good for you, some not, and it has nothing to do about the quality. Vince and I and James can eat peanuts all day, and they're good in terms of vegetarian protein, essential fatty acids, good. Another person just takes one little bite and they're dead. They have an anaphylactic shock. So it has nothing to do with the food. It's each person is an individual. And that's the extreme, is anaphylactic shock of death. But food intolerances can cause aches and pains, inflammation, make you feel crummy, make your stomach not work well. So these are the things that we work on in terms of getting the body. And then, as we already talked about, using now the concept of genetic expression, we're able to control that by using natural means. And the acid-base balance that we talked about before.